Acute coronary syndrome. Acute coronary syndrome refers to any group of symptoms attributed to obstruction of the coronary arteries. The most common symptoms prompting diagnosis of acute coronary syndrome is chest pain, often rotating of the left arm or angle of the jaw, pressure like incorrected and associated with nausea and sweating. Acute coronary syndrome versus stable angina. Acute coronary syndrome should be distinguished from stable angina, which develops during exertion and resolves after rest. In contrast with stable angina, unstable angina occurs suddenly, often at rest or with minimal exertion, or at lesser degrees of exertion than the individual's previous angina. New onset angina is also considered unstable angina, since it suggests a new problem in a coronary artery. Risk factor. Acute coronary syndromes, just like heart failure and stroke, are much more likely in people who have certain risk factors. These include smoking, high blood pressure, high blood cholesterol, diabetes, physical inactivity, being overweight or obese, a family history of chest pain, heart disease, or stroke. Pathophysiology. Atherosclerosis is by far the most frequent cause of coronary artery disease, carotid artery disease, and peripheral artery disease, but atherosclerosis alone is rarefied. Life-threatening manifestations of atherosclerosis, such as acute coronary syndrome, are usually precipitated by acute thrombosis, superimposed on a rupture or erode atherosclerosis plaque, with or without concomitant vasoconstriction causing a sudden and critical erosion in blood flow. Atherothrombosis. Atherosclerosis is a chronic and multifocal immune-inflammatory evoproliferative disease of medium-sized and large arteries mainly driven by the lipid accumulation. Atherosclerosis begins to develop early in life and progresses with time, but the speed of progress is unpredictable and varies markedly among different subjects. Signs and symptoms. Cardinal symptoms of decreased blood flow to the ear is chest pain, experienced as thickness around the chest and relating to the left arm and the left ankle of the jaw. This may be associated with diaphoresis, nausea, and vomiting, as well as shortness of breath. In many cases, the sensation is atypical, with pain experienced in different ways or even being completely absent. Some may report palpitations, anxiety, or sense of impending doom, and a feeling of being acutely ill. Diagnosis. Electrocardiogram. In the setting of acute chest pain, the electrocardiogram is the investigation that most readily distinguishes between various causes. Imaging and blood tests. As is only one of the many potential causes of chest pain, the patient usually has a number of tests in the emerging department, such as chest X-ray, blood tests, and telemetry. Predation scores. The ACATAP scores can be used to aid diagnosis, using 7 variables from the administration records. These score prediction crudely which the patient are likely to have myocardial ischemia. Treatment. People with presumed acute coronary syndrome are typically treated with aspirin, clopidogrel, or ticagrelor, nitroglycerin, and if the chest discomfort persists, morphine. Other analgesics such as nitrous oxide are often no benefit. Prevention. Acute coronary syndrome often reflects a degree of damage to the coronaries by atherosclerosis. Primary prevention of atherosclerosis is controlling the risk factors, healthy eating, exercise, treatment for hypertension and diabetes, avoiding smoking, and controlling cholesterol levels. In patients with significant risk factors, aspirin has been shown to reduce the risk of cardiovascular events. Secondary prevention is discussed in myocardial infarction. Prognosis. The TIM score. The TIM risk score can identify high-risk patients has been independently validated.